Hi everyone, I'm Kaye Sandot and I will be tackling about the sexually transmitted infections or STIs. So before we start, let us get to know first what is sexually transmitted infections or STI. STI or sexually transmitted infection is an infection passed from one person to another person through sexual contact or sexual intercourse. So this is an infection whereby a bacteria, virus, or a parasite enters and grows in or on your body. So sometimes an STI is called sexually transmitted diseases or what we call the STDs. So facts about sexually transmitted diseases or STDs. The term sexually transmitted diseases or STD is used to refer to a condition passed from one person to another through sexual contact. You may contract an STD by having unprotected vaginal, anal, or oral sex with someone who has the STD. It is sometimes called the sexually transmitted infections or venereal disease. That doesn't mean that sex is the only way of transmitting diseases, but also it depends on the specific STDs. Infections may be transmitted through sharing of needles or breastfeeding. Next is the symptoms of STDs in men. First is the pain or discomfort during sex or urination. Second, sores, bumps, or rashes on or around the penis, testicles, buttocks, thighs, or mouth. Third is the unusual discharge or bleeding from the penis. And lastly is the swollen testicles or painful testicles. However, women also experience symptoms having STDs. First is the pain or discomfort during sex or urination. Second, sores, bumps, or rashes on or around the vagina, anus, buttocks, thighs, or mouth. Third is the unusual discharge or bleeding from the vagina. And lastly, it is the itchiness in or around the vagina. Now let us go over to the types of STDs or sexually transmitted diseases. There are many types of infections that can be transmitted sexually, but most of the common STDs will be described on this video. So the first common type of STD is called chlamydia. A chlamydia is a certain type of bacteria called Chlamydia trachomatis that causes chlamydia. It is the most common reported STD among Americans. Many people with chlamydia have no noticeable symptoms. When symptoms do develop, they often include pain or discomfort during sex or urination, has untreated green or yellow discharge from the penis or vagina during her birth, and pain in the lower abdomen. The baby may develop pneumonia, if left untreated, eye infections, and chlamydia can lead to, infections of the antibiotics can easily treat gland or testicles, pelvic inflammatory disease, and even infertility. If a pregnant woman has untreated chlamydia, she can pass it to her baby during her birth. The baby may develop pneumonia, eye infections, and even blindness. However, antibiotics can easily treat chlamydia. The next is the HPV or human papillomavirus. The human papillomavirus is a virus that can be passed from one person to another person through intimate skin-to-skin or sexual contact. There are many different strains of the virus. Some are more dangerous than others. So, the HPV or the human papillomavirus is a small, non-enveloped deoxyribonucleic acid DNA or virus that infects skin-to-skin or mucosal cells. There is no treatment for HPV. However, HPV infections often clear up on their own. There is also a vaccine available to protect some of the most dangerous strains, including HPV-16 and HPV-18. If you contract HPV, proper testing and screenings can help your doctor assess and manage the risk of complications. So the next STD is the syphilis. A syphilis is another bacterial infection usually spread by sexual contact. The disease starts as painless sore, typically on your genitals, rectum, or mouth. Syphilis spread from one person to another person via skin or mucous membrane contact with these sores. The first symptom to appear is a small round sore, known as chancre. It can develop on your genitals, anus, or mouth, and it's painless but very infectious. Later symptoms of syphilis can include rash, fatigue, fever, headaches, joint pain, weight loss, and hair loss. If left untreated, late-stage syphilis can lead to loss of vision, loss of hearing, loss of memory, mental illness, infections of the brain or spinal cord, heart disease, and death. Fortunately, if caught early enough, syphilis is easily treated with antibiotics. However, syphilis infection in a newborn can be very fatal. That's why it's important for all pregnant women to be screened for syphilis. The earlier syphilis is diagnosed and treated, the less damage it does. So the next STD is the HIV or human immunodeficiency virus. So a virus that attacks cells that help the body fight infection or making a person more vulnerable to other infections and diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or sex without a condom or HIV medicine to prevent or treat HIV or through sharing injection drug equipment. HIV can damage the immune system and raise the risk of contracting other viruses or bacteria and certain cancers. If left untreated, it can lead to stage 3 HIV, known as AIDS. But with today's treatment, many people living with HIV don't ever develop AIDS. In the early acute or stages, it's easy to mistake the symptoms of HIV with those of the flu. For example, the early symptoms can include fever, chills, aches and pains, swollen lymph nodes, sore throat, headache, nausea, or rashes. So the next common STD is gonorrhea. Gonorrhea is another common bacterial STD. It is also known as the clap. Many people with gonorrhea develop no symptoms, but when present, symptoms may include a white, yellow, beige, or green-colored discharge from the vagina or penis, pain or discomfort during sex or urination, more frequent urination than usual, itching around the genitals, and even sore throat. And if left untreated, gonorrhea can lead to infections of the urethra, prostate gland or testicles, pelvic inflammatory disease, and even infertility. It's possible for a mother to pass gonorrhea onto a newborn during childbirth. When that happens, gonorrhea can cause serious health problems in the baby. That's why many doctors encourage pregnant women to get tested and treated for potential STDs. Gonorrhea can usually be treated with antibiotics.